Picture a battlefield. Not the clean, distant, digitally rendered battlefield of a film. The real thing. A Norse raiding force has just broken through a Frankish defensive line on the Seine River. The fighting lasted less than an hour. In that hour, 7 Norse warriors took serious wounds. Not flesh wounds. Not the cuts and bruises of incidental combat. Serious wounds. One man has a sword cut across his right forearm that has gone to the bone. One has an arrow still lodged in his left shoulder, the head buried deep in muscle. One has a wound to his abdomen, a spear thrust that entered below the ribs and exited through his side. One has a crush injury to his left hand from a shield boss impact, 2 fingers clearly broken, the hand swollen to twice its normal size. 3 more with varying degrees of slash wounds, deep cuts, blunt trauma. 7 men. In any other medieval army of this era, Frankish, Byzantine, Anglo-Saxon, Islamic, at least 3 of these men would be dead within 2 weeks. Not from the wounds themselves, but from what came after. Infection, sepsis, the slow compounding failure of a body fighting bacteria it cannot see while its medical system bleeds it, applies contaminated poultices, and prays. In a Norse force with a competent healer, 6 of the 7 survive, possibly all 7. Not because Norse warriors were physically superior to other men, because the person treating them knew things that almost no one else knew. Things that modern medicine has spent years confirming. Things that should not have been knowable without microscopes or germ theory, but were. Because someone, far enough back that the origin was lost, had paid attention, and remembered, and passed it on. To understand what the Norse got right about medicine, you first need to understand what everyone else was getting catastrophically wrong. Medieval European medicine, the formal, educated, institutionally practiced medicine of the 9th through 12th centuries, was based on a theory developed by the ancient Greeks. Humoral theory. The body contained 4 humors: blood, phlegm, yellow bile, black bile. Health was the balanced state of these 4 fluids. Disease was their imbalance. Treatment was restoring balance. In practice, this meant bloodletting. A sick person, a person with a fever, an infected wound, a systemic illness, was bled. A vein was opened and blood was drained from the body. The specific quantity, location, and timing were determined by elaborate theoretical frameworks that had no relationship to what was actually happening in the patient's body. The person who needed their immune system operating at maximum capacity had their oxygen-carrying immune cell-containing blood deliberately removed, and died more quickly. The medieval physician who performed this treatment was not stupid, was not malicious, was doing exactly what their training told them to do. Applying the most sophisticated medical theory available to them with genuine skill and genuine intention to help, and killing people. Because the theory was wrong. The Norse had no theory, no systematic medical philosophy, no humoral framework, no trained physicians in the formal sense, no medical schools. What they had was observation, direct, practical, long-term observation of what happened when you did specific things to specific kinds of wounds, what healed, what killed, what made the difference, encoded into practice, into the knowledge that specific women, the healers of Norse communities, carried and passed on and refined across generations. No theory, no framework. Just, this works, this doesn't. Do the first thing, don't do the second. And in the specific domain of wound treatment, their observation had produced something that the formal medical tradition would not independently arrive at for another 800 years. The Laknunga. The word is Old English. It means remedies. It is a medical manuscript, a collection of medical knowledge compiled in Anglo-Saxon England, drawing on both the formal Mediterranean medical tradition and the folk medical practices of the northern European peoples. It was written down around 1000 AD. One of the plants it describes for wound treatment is Achillea millefolium, yarrow, the same plant that Norse healers were using across Scandinavia, the same plant that grows across the entire northern European and Scandinavian landscape, the same plant that modern pharmacological research has confirmed contains compounds with genuine antimicrobial and anti-inflammatory properties. Active compounds that actually do what the healers who used it believed they did. Stop bleeding, reduce infection, accelerate healing. This convergent documentation, the same plant being used for the same purpose in both Norse and Anglo-Saxon medical traditions, and modern science confirming the mechanism, is not a coincidence. It is evidence of genuine empirical medicine, medicine derived not from theory but from observation. Someone applied yarrow to a wound and the wound healed better. They told someone else, who applied it to another wound, which also healed better. Across enough wounds, across enough healers, across enough generations, the plant became standard practice. Not because anyone understood why it worked, because it worked. The Norse medical tradition was full of this. Plants used for specific purposes that modern pharmacological analysis has confirmed contain the active compounds appropriate for those purposes. Juniper berries, used in Norse wound treatment, contain compounds with demonstrated antimicrobial activity, effective against the specific bacteria most likely to infect surface wounds. Bog myrtle, used in Norse preparations for digestive complaints and fever, contains compounds with anti-inflammatory and antimicrobial properties. Iceland moss, used for respiratory conditions, wound dressings, and as a general strengthening preparation, contains eosnic acid, one of the most potent natural antimicrobial compounds known. The Norse were not practicing herbal medicine in the sense of placebo effect folk remedies. They were practicing empirical pharmacology, without knowing that is what it was called. But here is what separates Norse wound medicine from simple herbalism. It was systematic. The onion test. This is the detail that modern medical historians return to repeatedly when they discuss Norse wound assessment. It appears in the Norse medical tradition, documented in saga accounts of battlefield medicine, as a standard assessment for abdominal wounds. The procedure was straightforward. A preparation of strongly flavored food, onions, garlic, leeks, was given to the wounded person to eat. Then the healer waited and smelled the wound. If the smell of onion or garlic emerged from the wound, the diagnosis was penetrating abdominal injury with gut perforation, a wound that had entered the abdominal cavity and pierced the intestine. The treatment was different, the prognosis was different, the entire management approach was different. If no food smell emerged, the injury was classified as a wound that had not penetrated the intestinal tract. Different treatment, better outcomes. This test works. The physiological mechanism, the movement of volatile compounds through a perforation in the intestinal wall, is real. Modern emergency medicine does not use onion tests because it has better imaging technology, but the underlying principle is sound. The Norse were performing differential diagnosis, distinguishing between wound types based on clinical findings, without X-rays, without CT scans. The wound assessment did not stop at the onion test. Norse healers examined wounds with a systematic attention that the sagas record. Wound depth assessment, probing wounds to determine depth. Contamination assessment, searching for debris, bone fragments, and clothing fibers. Wound closure timing, the understanding that wounds should not always be closed immediately. Some wounds benefit from remaining open for drainage. Closing a contaminated wound traps the contamination inside. This principle was not formally established in European practice until the late 19th century. The Norse were practicing it in the 9th, because they had observed that wounds closed immediately over contamination killed people, and wounds left open for drainage, then closed later, killed people less often. Observation, memory, practice. The honey dressings. Raw, unprocessed honey applied directly to wounds. The mechanism, hydrogen peroxide production on contact with wound exudate. Modern wound care uses medical-grade honey for exactly the wound types Norse healers applied it to. The Norse sutured wounds, the closure of lacerations to facilitate healing. Basic surgical technique that sounds obvious, until you realize the alternatives were far more common. The cauterization, for bleeding that suturing could not control, the Norse used heated iron, not indiscriminately, but with precision. The diet. Wounded warriors were given specific foods, high protein, easily digestible. fermented dairy, fish broth, and medicinal plant preparations. Modern trauma medicine knows that protein is a critical determinant of healing. The Norse knew that wounded men fed this diet healed faster. Here is what the Norse medical tradition could not fix: internal injuries. The onion test identified gut perforation. It could not repair it. A penetrating abdominal wound with bowel injury was, in the Norse framework, a death sentence. Not immediately, not inevitably on the day of the wound, but within days as the infection spread. Death. And the Norse knew this. The sagas record wounded men being told directly that their wound was a death wound, not a wound we hope you survive, a wound you are going to die from. Here is how long it will take. Here is what the next few days will feel like. Here is what we will do to make it more bearable. The Norse healer who performed the onion test did not pretend otherwise. She told the truth. And the wounded man, raised in a culture that treated death in battle as an expected outcome, received that truth, and prepared, not with despair, with the specific practical preparation of a man who intends to use his remaining time, dictating wishes regarding property, settling disputes, sending messages, choosing consciously what their last days would look like. The Norse had no hospice system. They had something older and simpler, a framework that treated death as a known quantity, not a failure, not a catastrophe to be managed, a known quantity that the community witnessed. This is the dark gift of the Norse medical system. The wounds it could not heal, it acknowledged honestly. Just, this is what is happening. This is how long you have. Here is what we will do with it. In 2015, a team of microbiologists at the University of Nottingham published a paper. They had been working with a recipe, not a modern recipe, a recipe from a medieval Anglo-Saxon medical text called Bald's Leech Book, a manuscript compiled in the 9th century. Drawing on the same tradition of Northern European empirical plant medicine that the Norse healers practiced. The recipe was for an eye salve. It called for garlic, onion or leek, wine, ox bile, brass vessel, specific preparation instructions, a specific waiting period before use. The researchers made it, exactly as described, using the exact ingredients, the exact proportions, the exact preparation method. Then they tested it against Staphylococcus aureus, one of the most dangerous and antibiotic-resistant bacterial pathogens in modern medicine. The bacterium responsible for MRSA, the infection that kills tens of thousands annually, despite the full resources of modern medicine. The 9th century eye salve killed 90% of Staphylococcus aureus cultures in laboratory testing. 90%. A preparation made from ingredients in any medieval kitchen, outperforming modern antibiotics against one of the most resistant pathogens. The researchers were careful. The salve was not a cure for MRSA yet. Laboratory conditions were not clinical conditions. Further testing was needed. But the implication was impossible to miss. The empirical medical tradition of the medieval Northern European peoples had found something real, something modern medicine was now going back to study because modern solutions were failing as bacteria evolved to resist them. And the old solutions, built from thousand-year observation of what worked, were still working, because bacteria had not evolved to resist the specific combination of compounds in garlic, ox bile, and onion. The Norse healer who packed a wound with honey and yarrow did not know about hydrogen peroxide or antimicrobial mechanisms. She knew that it worked. She knew because she had watched, compared, remembered, adjusted. Her tradition was a record of what actually happened when you did specific things to specific wounds, maintained across generations, by people who could not afford to be wrong, because being wrong meant the warrior, the farm, and the family were vulnerable. So she paid attention. The notebook she kept was the memory of every woman who had treated every wound before her, still working, 1,000 years later, in a laboratory in Nottingham, paying attention to what works and writing it down.